So if everybody could come on camera, that'd be great. Chelsea and Fatima, can you come on camera, please? Thank you. So hi, is everybody? Welcome to week 6. We are at our halfway point. Amazing. Amazing. How's everybody doing? I know Fridays are rough, long week. So today we're going to start out by doing quiz 4. So if you've tried to pull up the quiz before a few minutes ago, you're going to need to refresh it. Let's not start that yet. We'll start in a few minutes. Let's see. Then we're going to review the quiz, go through some of the rationales, and do some content of the concepts from the quiz. Then whatever I don't cover in the quizzes, we'll cover in a brief review of the 4 concepts. This week we're covering occupational health, environmental health, barriers to learning, and reinforcing health education. And then after that, we'll break out into 3 breakout rooms, and we're going to do a health education case study that reinforces the teaching from today. So that's the way class is going to go today. Couple of housekeeping things from the week 6 announcement. Okay, hopefully you read all through the announcement and saw that the homework grades are turned on. So if you saw a little bit of bump in your overall grade, that means your homework is adding to your grade. Okay. If you've been not turning in homework or doing poorly in homework, that is going to reflect on your overall grade and it's going to pull it down. Okay. So homework grades will be on this week, this past week, and next week. Okay. They'll be turned off at the end of week 7. Because week 8 is drop week, right? That's why they're turned on for a couple of weeks to see how your homework is affecting your overall grade. At the end of, let's see, we're at midweek. So I have to do what's called mid-module assessments. And I need to do them for students that currently have a KGA below 78. So if you receive a mid-module assessment from me, you'll see that it asks you to schedule a time to speak with me, and we will come up with a game plan going forward for the second half of the term. Okay, and I'll be sending those out probably early next week. Okay, next week is exam week. All right, so you guys will be taking exam 2 a week from today at this time. We had a review on Wednesday. There was no attendance, so therefore the professor didn't do the review. So you have 2 more opportunities to attend live reviews. One is today after class. I'm doing mine at 6 p.m. Eastern time. And then Professor Kershaw does hers on Sunday evening. I think it's 7 p.m. You have the master calendar that was sent out in week 1. So if you need to review the times, I'm pretty sure hers is at 7 p.m. Eastern time. And then you'll get the recordings, assuming we have attendance. And we do the reviews. You'll get the recordings from myself and Professor Kershaw. So you'll be able to review those in the event that you can't attend them live. Okay. Group projects, you should be working on your group projects. They are due a week from Sunday. So at the end of week 7. Okay. So I don't think I've heard from any groups here about any issues with getting everybody together. So that's good. All right. So you should be working on your group projects. Does anybody have any questions before we get going? No? Okay. I'm going to put the access code, which is my last name, in the chat. So feel free to get going on your quiz. I'm going to mute myself and make sure everybody else is muted. let's see, it is 4:05, 20 minutes, 22 minutes. So we will come back at 4:25. All right. So everybody, when you're done your quiz, submit it, and then you're free to go off camera until we come back at 4:25. Okay. Does anybody have any questions? Like I said, if you pulled up the quiz before 4:00, refresh it because it wasn't open until right at 4:00. All right. Okay. Take your time. If you have any questions in the next 20 minutes, if you would put them in the chat rather than come off mute. Hey, it looks like everybody's done. You wouldn't mind coming back on camera? We'll have a look at the quiz. How'd everybody do? Couple of questions. Is the concept recording you're getting the weekend prior helpful?
I think
I
so.
think so.
Okay, with an introduction to the concepts.
I couldn't launch this one, so I can't really answer that. But the one from the last week helped me. It let me launch it.
Yeah, why couldn't you launch it?
I don't know. I don't know if it was my bad on my end or what, but it wouldn't let me like load it.
Was everybody else able to do that? To see it?
Yeah, I saw it.
Okay, okay. The other question I have, since it's new this term, is putting rationales in the quiz questions. Is that helpful?
Yes, very
Yeah.
helpful.
Okay,
Yes.
good. Because as you prepare for exam 2 next week, you have lots of resources. And before I forget, Professor Kershaw is working on a week 6 Kahoots today. So I should have that to you later on today as you prepare to study for the exam. All right, so you will have a week 4-5 combined Kahoots that was sent a few weeks ago, or last week, I think. You'll have a week 6 Kahoots. So you'll have a Kahoots representing each week. You'll have 2 quizzes representing exam 2, quiz 3 and 4. So make sure you review those rationales. You have 3 weeks of concept recordings. So make sure if you haven't reviewed them, you review them. You have your PowerPoints and you have your readings. So you have lots of resources to prepare for the exam. And I've had lots of student reviews with students who score below a 78 and some actually above a 78. I'll tell you the trend I'm noticing. I'm noticing that students aren't taking the time to pick out important parts of questions, important words. Okay, and this is across the board. I've met with several students from all my 4 sections. So these are my general observations. Students are reading the questions too quickly. They're not picking out the key words like what is the most, what is the first, what is the initial, what is the least. Okay, so you really need to read these questions. And of course, I always suggest, whether people take me up on it or not, that you use the highlighter in ExamSoft. Okay, to highlight any important words, phrases, catchwords, populations that are going to help you guide you to the right answer. And along with the highlighter, I also suggest you use the eyeball. And that eyeball is the opportunity to cross out answers that you know are not correct. So that hopefully the second time you're reading the question, you have your highlighted words, phrases, whatever, and you may have 3 answers to choose from or 2 answers to choose from. Or you may have all the same answers to choose from, but guess what? It's not a select all that applies. So how can they all be right? Got to go back and read the question and see what key word you missed. Like what's the most important? What's the first? Okay. The other observation is overthinking. Here's a simple rule of thumb. If the information is not in the question, it doesn't exist. So as you start adding information from your own mind into the question, like, well, what if? There's no what ifs. All you need to answer the question, to pick the right answer, is the information in the question. Okay? And my third observation is don't change your answers. Okay? Unless you accidentally click the wrong answer, don't change your answers. Okay? Don't change your answers. Okay? Unless you can have a good reason that you changed your answers. Not, oh, I think I heard her say this in lecture. I think I read this somewhere. My teammate told me this. Those aren't good enough reasons to change answers. All right? So those are my 3 observations from 2 weeks worth of meeting with lots of students, a couple of dozen actually. All right, so those are my takeaways. I don't know if they're helpful, but those are my observations. Okay. Questions? All right, let's take a look at the quiz. Let's see, I have a chat. Okay. Okay, let me make sure I have this pulled up and ready to go. Okay, I do. Okay, can everybody see my screen? Yes, no,
Yes.
thank you. Okay, so the first couple of questions are a review, since we talk
Yes.
good part of the term about vulnerable populations. What do we know? Now, what key word did you pick out in this question?
Not
Not.
Not. Okay, so what's not true about vulnerable populations? We know that A is true. They often have poor health outcomes. We know that B is true, have higher rates of communicable diseases. We know that D is true. They're potentially exposed to higher levels of crime and violence. What's wrong with C?
They would have a
They
higher.
have a high, oh, sorry.
Higher. Why? Why do they have higher mortality rates? What
'Cause they
contributes to
have
that?
more- They get more like chronic illnesses and
Mhm.
which could
They
lead
don't
to
go to the doctor,
Yep.
so they find things later.
They're not focused on primary care, are they? Primary prevention. Maybe there's also an issue with healthcare access, right? So let's have a look at the review. This is an excellent review of vulnerable populations in this rationale. All right, they often have poor health outcomes compared to other people in terms of morbidity and mortality. They have a high prevalence of chronic illnesses, hypertension, as an example, high levels of communicable diseases, including TB, maybe Hep B, STDs, upper respiratory tract infections, including influenza. They also have higher mortality rates than the general population because of some factors we just identified. Poor living conditions, maybe poor diet, health status or health access. Maybe they live in a community that has a high crime violence rate, including domestic violence. Okay, so that's a good summary. Okay, we talked about this question last week when we were addressing the LGBTQ population. And then we branched that out that this question is important for all vulnerable populations, right? Which of the following would be the initial consideration by the nurse who's working with vulnerable populations? What is the key word in this question?
understanding
Initial.
initial.
Initial. What's initial mean? First. What's the first consideration made? Right? It's not that A, C, and D are incorrect answers, because they're not. If you're working with the LGBT community, eventually you are going to want to be knowledgeable about same-sex marriage laws within the state, right? If you're working with the homeless population, eventually part of your assessment will be, what is the family structure within the homeless family? And again, working with LGBTQ population, eventually part of your assessment will be gender identity and sexual orientation in a safe environment. But what do you first have to do? B. Right? The foundation, this is the rationale, foundation for a good nurse-client relationship, and that goes with anybody, including vulnerable populations, begins with a nurse's thorough understanding and self-awareness of what your own beliefs are, your own biases, your own feelings, and your own values. Right? And I would add in culture. Right? Not just vulnerable populations, but different cultures that you're working with. Always, first and foremost priority is to understand your own personal feelings. Because that will impact, will it not? That will impact your care. Okay, so Nurse Sarah discusses discharge with a new nurse during orientation. Which statement by one of the nurses will Sarah need to correct? What kind of question is this? Is this a positively framed question or a negatively framed question?
No, the negative,
Why is it negative, Brinley?
Negative.
because you're finding something that they're saying that's wrong.
Yeah, or incorrect, or needs to be clarified, right? Right? When do you guys know this? When does discharge planning start?
From the beginning.
At admission.
At admission.
Admission, right? D, we are not going to be starting our discharge planning once the social worker receives the instructions that the patient's going home. Why do we start discharge planning upon admission? Let's look at the rationale. Discharge planning requires looking ahead to meet the patient's, pardon me, ongoing needs at home, right? This process of planning begins at the time of admission because we have to assess a lot of things, right? We have to assess any special needs the client may need at home. Learning to identify appropriate education moments that we can work with the client during their admission, right? Providing learning opportunities that are brief, focused, preparing the patient to be able to take care of themselves. Also, what's not in the rationale, but what if they need additional services? What if they need PT? What if they need OT? What if they need medical equipment? All this starts at the beginning. Okay. So we have a newly diagnosed patient with diabetes. The patient needs to, this is a teaching question. Okay. This is actually falls under barriers. Okay. Patient will need insulin injections. The patient is unsure of how to administer the injections. Which reply by the nurse will gain more information from the patient. So we're looking to gain more information. So we would ask them D. Would you share how you're feeling about having diabetes and having to administer insulin? Why would we want them to share their feelings first? Won't it be important to know how they're feeling so
Yes.
that you can make that part of your teaching plan?
Yes.
What if they're
So,
confident? What if they're confident? What if they're not confident? What if they are motivated to learn? What if they're not motivated to learn?
Mhm.
What if there's a language barrier and they don't understand what you're going to be teaching to them? What about literacy? What if they have a low literacy with regards to understanding health information? So you have to do an assessment of how they're feeling about it. They may be on board and motivated, or they may be terrified. And depending on how they're feeling is going to affect how you plan your teaching. Let's look at the rationale. Assessing the patient's readiness to learn is an important part of developing a plan for teaching. Right? Encouraging them to talk about their feelings, their concerns, their anxiety, and their goals. Right? This helps us develop our plan. Motivation plays a large role in effective learning. Right? If they're motivated, do they have the desire to return to independence? Right? Return to their home with the confidence to care for themselves. Right? Teaching them about their disease or their condition, their injury, their illness, teaching them the importance of following a teaching plan as they strive towards independence is critical, right? Patient education sessions are more successful if the patient is comfortable and rested, and there's a minimum of interruptions, right? So asking the patient, when could I spend a half an hour with you in the next couple of days, starting to talk about discharge planning? Not, I have a full patient load. I only have 10 minutes right now to do the teaching. That's not the way to approach it, right? Plus, we want to know, do you want other family members included in the teaching? Right? If they live with other family members who are going to be helping them, participating in the care, does the client want them present for teaching? So it's all based on what the patient's needs are. We want the patient to be comfortable, rested, and ready to learn. Right? All right, Sam is in the clinic today. He's a high school graduate. There are several pages of discharge instructions. The nurse can assess his ability to read and comprehend written instructions by doing which of the following? Okay. So, in order to assess reading comprehension, because if you look at the rationale, low literacy is a very common barrier. All right. I mean, have you ever worked with patients that you go through everything and you ask them, do you understand they do this? Right? But do they really understand? All right. So we know that B is the correct answer. We want to have Sam read the discharge instructions to see if he can read, and then discuss what has been read to determine comprehension, right? We know A is incorrect. Graduation does not guarantee reading comprehension. Okay. C is irrelevant. When did you graduate from high school? That's irrelevant. And D, is a bit, not condescending, but a bit judgmental. Okay. We don't have to ask that question if we can do B, asking him to read. Okay. So this is part of evaluating whether the client is able to read and comprehend. Because otherwise, if they're not, whatever teaching you do is going to be ineffective, right? So the rationale, evaluating the effectiveness of patient education is critical to the success of the process. And that's how we evaluate, right? By assessing their reading and assessing their comprehension. It involves giving feedback from the patient regarding what was taught and using the feedback to determine effective learning if it's taken place. Right? I use the example of teaching kids how to use their glucometers, new diabetics, or how to give themselves an insulin pump dose or give themselves an injection. Okay. It gives me the opportunity to teach and then the opportunity to return demonstrate. Right? And we can talk about what they did, what you did correctly. Here's some suggestions for improvement of what we just went over. Okay. And as you're having that comprehension, when a patient is learning the information rather than skill, you ask them questions about retention, comprehension of the material taught, right? Giving them the time to answer the questions, right? It's always helpful to have printed material out. If there's a language barrier, it's always helpful to have printed material out in their own native language. When we were doing at the beginning of every school year, when we were doing immunizations, here's what you need to have, here's when they're due, here's the intervals, here's how to do a personal exemption, medical exemption. For the parents that had language barriers, we had to print those instructions in numerous different languages. Okay. Let's say you have a client that comes comes, this is a little bit off topic, but um, it covers this concept. Let's say you have a patient that comes to urgent care, and the first thing they say is, don't speak English. What do you do? What's the most effective way to handle that?
Interpreter, maybe?
Interpreters. Interpreters are primary to the success of that conversation. Why might we be hesitant to rely on a family member who appears to speak some of the language? Why would we be a bit hesitant?
Everything.
Say that again, Sierra?
Samara, and they probably
Samara.
won't be able to communicate everything effectively.
Exactly. How do we know they're able to comprehend what we're teaching them? Exactly. Okay. Lisa knows that low literacy, which we've talked about, is a learner-related barrier. Which of the following statements by the client indicates the client is experiencing a learner-related barrier to new information? Select all that apply. B and C are your correct answers. Why is B correct? I don't like to read. Just tell me what I need to know. What's that a red flag for?
Maybe he doesn't know how to read.
Exactly. Exactly. Oh, I'll figure it out. Just tell me what's important. Same thing. Maybe they're not able to read, or they have poor reading skills and they're not able to comprehend, right? So before beginning to teach, you must figure out or assess for factors that might interfere with the client's ability to learn. There's several conditions that can affect the learning process. What if the client is visually impaired? What if they're hearing impaired? What if they have developmental delays? What if they have issues with motor function? Literacy? What if they have impaired cognition? What if they're not motivated? What if there are cultural barriers, language barriers? Okay. Often patients will express a lack of self-confidence. I'll never be able to do that. Right? And going back to a few questions ago, we must explore the feelings. You know, if they say, I don't have the self-confidence, we have to dig. Why? Why do you not feel like you have the confidence to learn how to give an insulin shot or take your own blood pressure or test your own blood sugar? Okay. And, you know, we're going to be doing teaching in every part of nursing that we are involved in. Whether we work in a hospital, a clinic, an urgent care, a medical office building, treatment center, teaching is one of our primary roles. So we need to make sure we can assess how effective our teaching is going to be by understanding how the client's feeling about being taught and what's being taught. Okay, question 7 jumps into occupational health. All right, what did you learn about what is occupational health? Where is this setting?
Work environment.
Right. Occupational health is carried out in work environments. Okay, so the nurse may conduct an assessment of the workplace itself, right? This is typically known as a worksite walkthrough or a survey. While the nurse is walking through the worksite, direct observation allows the nurse which of the following? All of them. Okay, and if you read through your module reading, which I'll pull up here in a minute, about occupational nurses, it talks about all the different roles and what he or she should be accomplishing on a work site walkthrough. Right? They need to understand the work processes and the materials. What kind of workplace is it? Is it a hospital? Is it a bank? Is it a fast food? Is it an industrial site? Is it a meat processing plant? Is it a recreation center? Okay. They need to understand the requirements of various jobs. Think about all the different job descriptions in a hospital. Physicians, nurses, physician's assistants, OR techs, transport, food service. What else? I mean, all the different job descriptions. They have to have an understanding of what the requirements are for each job description and make sure they have educated and trained these employees and prepared them to be able to perform safely within their job. They also need to be aware of the presence of actual or potential hazards. You know, those MSDS sheets that we see all over our employers? That's what they need to be aware. You know, let's say you're working in the OR. What are potential hazards? What are potential chemicals? What if there's a chemical spill? Do we know what to do? And they're also observing during this walkthrough workplace practices, the work practices of employees. Are they observing the people who work in transportation or transport? Do they transfer patients correctly from the bed to the chair? What about lifting? Do they lift appropriately? Or based on how they were trained? All right, so that's what this rationale explains all for. Nurse may conduct an assessment of the workplace to learn about what is the business, what's the work. Okay. Question 8. Mary the nurse knows that there is no safe occupation or profession. On one of the regularly scheduled primary interventions Mary will implement is, which one of these is primary?
The first one,
Right. Why is it primary?
because it's providing education.
To prevent, right? To prevent illness, injury, accident. What is B? Primary, secondary, or tertiary?
Tertiary.
Right. We're administering medications for something, right? They have something. What is C?
Secondary.
Secondary. We're screening, right? And what's D?
Tertiary.
Why? Because they've had an injury, right? So in the rationale I gave you, this is from your book. I gave you the primary, secondary, tertiary examples related to occupational health. So let's look at these. Some of the primary preventions for occupational health, workplace setting, teaching coping mechanisms, okay? Provide healthy diet education and safety education, educating on the use of proper lifting, educating on the use of proper protective equipment. Those are all prevention. We're trying to prevent something. Okay, secondary. Let's say you work in a large industrial plant that's super loud. Maybe the occupational nurse will want to do annual screenings for hearing losses, right? Blood pressure screenings to identify any potential conditions that employees may have that hasn't been picked up by, say, their doctor. Is screening for stress and burnout. We know that mental health issues are abundant across our country. People are taking their stressors to work, right? So it is beneficial to screen for stress and burnout. Who's at risk for, I don't know, workplace violence? Who's at risk for, you know, having mental illnesses that impact their work, right? So screening for that. Then tertiary. limited duty program for workers recovering from illness or injury. Let's say somebody hurt their back or pulled their back, whether it was inside the workplace or outside the workplace. And they're getting ready to come back to work. Right? Can they come back full duty? Can they come back limited? That's what the occupational nurse has to figure out. What are the discharge recommendations? Are there any restrictions that need to be applied because of the injury? Okay. Say somebody had is supposed to be wearing a wrist splint for carpal tunnel. Right? That's in their restriction. That's in their guidelines for return to work. Well, that occupational nurse needs to be monitoring that. Same with, let's say they had back surgery or back injury. In their return to work guidelines say they need to be wearing a back brace. Well, that's up to the occupational nurse or department to be following through with that. Does that make sense? Okay, ethical, which step of ethical decision-making is which step of ethical decision-making process is identifying the ethical issues in the situation? That's the first issue. That's the first thing we have to do, right? Because how can you have an ethical decision-making group talking about something if they don't know what the issue is? Right? So the very first step in the ethical decision-making process is identifying what the issue is you're going to discuss. Right? Does that make sense? Okay, last question. This is an environmental health question. The home health nurse works in the community with high rates of complex chronic illnesses and neurological disorders. Which environmental characteristic is a priority? So after reading through your environmental risks reading, what potentially could be a problem here? What's the priority?
The soil.
Presence of several manufacturing plants near the community's river. Right? That's a big risk for people living, or people having that's a risk. Increase of chronic complex illnesses and associated neurological disorders. Okay, that's when you have manufacturing plants near the river, there's a high risk of contamination. Has anybody ever seen the movie Erin Brockovich? Anyone? It's an excellent movie. It's about an environmental disaster down in a small town in Texas where there was a big plant, PG&E, that was dumping toxic waste, toxic materials into the water, the river. It flowed downstream. And a small community in Texas was getting sick. People were dying. There were miscarriages. There were stillbirths. There were people getting cancer, kids, adults, elderly. And it was all from toxins in the water. Okay, so let's look at the rationale for environmental health. Assessing a patient for environmental health risks requires you asking, let's say you're doing an environmental assessment with an individual or a family in the community. You got to know where they live. Where do you live? Where do you work? Where do you go to school? Where do your kids go to school? What's your dietary history? What are they eating? Are they eating a lot of fish? Maybe high in mercury. Okay. Do you live, think about your own community where you live now. Do you live in a community that is close to a transportation hub, airport, railways, heavy trafficked highways? Do you live in communities that are older houses built before the 70s or 60s that have potentially a high risk of lead exposure? Do you live in communities that are dirty? Are they clean? Are there industrial sites? Are there waste dump sites? Are there nuclear power plants? Are there, do you live in a community that is at risk for air pollution? I live a half a mile away from a major thoroughfare going from east to west coast, I-70, and I live at the bottom of the mountains, right before you start heading up. So all these big 18-wheelers that come through day after day, 24/7. You can smell their brakes. The area I live in is challenged air pollution from all these trucks coming down and all the pollution that goes with automobiles. Right? Every one of your communities has environmental risks. Have you thought about it? I mean, we'll get into this in just a second, but the biggest environmental risks: air, water, soil, and food. We've talked about air pollution, right? You may live in a area that has high air pollution. I get alerts on my phone all the time. Air quality alert, all the time, daily it seems. Right? You may live near water, rivers, streams, lakes. What if people fish in those areas? What if the water's contaminated? I mean, I just take for granted that somebody's monitoring that. What if, what if you live in an older community that it's determined maybe the soil was contaminated? They built on top of contaminated soil. That's a problem too. And think about food. I assume when I go to a restaurant or go through a fast food, I assume that everybody's doing their job correctly. These are environmental risks, right? They're cooking the food the right way, they're storing the food at the right way, they're serving it at the right temperature, and the employees are washing their hands or being cleanly, right? But what happens when you hear all the time about food outbreaks of salmonella, right? I mean, I take way too much for granted with regards to the environment. I assume everybody's monitoring and everything and doing their job, but that's not always the case. And that's when you start to see all these let me read something to you. Environmental hazards are responsible for over 1/2 of the total burden of disease in the world. They contribute to over 80% of communicable and non-communicable diseases and injuries. That's astounding. Astounding. But if you just think about, I'm staying with environmental health here. Think about what you have in your own place where you live. Cleaning chemicals, gardening chemicals, herbicides, pesticides, right? I mean, just think about your own residents, think about your own community. What environmental risks that I haven't mentioned are in your community? And you can go on the EPA website, Environmental Protection Agency, who oversees all the environmental rules and laws and guidelines. You can actually go on their website and plug in your zip code, and they will shoot you back what are the high environmental risks in your community. And when I put in my zip code, number one that comes up is air quality, which is me living next to a big highway. What are some environmental risks in your communities? I'm just curious. Nobody has any environmental risks in their community. There is
I live
clean.
right by a highway also. My
Yeah.
house is like right off the highway.
Yep. Do you have air quality issues?
Air pollution. I'm from the Philippines, so shh. I'm sorry, that's my dogs.
It's all
I'm
right.
from the Philippines, so it's like air polluted. Like it's crazy.
Yeah. It is crazy. All right, so let's see what we haven't covered here. So I want to get to the case study here. These are our 4 concepts this week. Trying to see what I didn't cover from the quizzes. Occupational health. We know about workplace assessments, what they're supposed to do. We evaluate work practices of the employees. Observe effectiveness of your education that you provided as the occupational health nurse. Are people hearing and implementing your safety teaching? The other thing that occupational nurses, not only do they see various injuries on site, right, but people may acquire diseases, not maybe from work or maybe outside of work. People have cancer. People have new diagnoses of whatever. How does that impact their ability to do their job? Okay. We know that every single industry has serious hazards. There is absolutely no environment, no work site that is completely risk-free. Right? I know we all tend to think about hospitals, but think about rec centers, risk of injury from equipment. Think about fast food places or restaurants, maybe risk of burning from cooking if you're working in the kitchen. Every single occupation. Think if you're working in the farm, the risks of injury or accidents from equipment or from pesticides being sprayed. Okay. We talked about some of the roles of the occupational health nurse, educators, case managers, meaning case managers are coordinators of care. All right, so let's say somebody gets hurt in the job. What are they all going to have to do? Well, they're going to have to work with the employee's going to have to work with the occupational health department to look at leave, paperwork, going to have to work with the insurance companies, going to have to work with the doctors about release to work, going to have to work with the employees. Are they following up on their plan? Are they going to PT? Are they going to OT or whatever? They going to cardiac rehab. They had a heart attack and had surgery. The other thing we didn't talk about is crisis intervention and counseling. Well, we did talk about it a little bit. A lot of people come to work with a lot of things going on in their life. Okay. Think of all the high risks. Maybe maybe a family member is unemployed. Maybe there's been a divorce. Maybe there's been a death. Maybe there's been domestic violence. Think of all the stressors people come to work with. You talk to your peers all the time, right? So part of the occupational nurse's job is also to provide those resources, counseling, group therapy. A lot of big organizations have what they call employee assistance programs, EAPs. Some of you, or you may know people who have taken advantage of it. All right. So that occupational nurse is also going to be working with employees to get them the resources they need for counseling or some kind of crisis management. They're doing a lot of health promotion, risk reduction, a lot of primary care, maybe teaching about work balance, teaching about healthy diet, effects of exercise on health, right? So they're always involved in primary, secondary, and tertiary. Okay, legal and regulatory, right? Part of legal and regulatory, we went through that, is making sure that the place of business is in compliance. Are they in compliance with HIPAA laws? Are they in compliance with employees being entitled to take family medical leave? Okay. We talked about some of this, talked about the first two bullets. Number 3 bullet, children are much more vulnerable to environmental hazards. They have underdeveloped immune systems, right? They aren't as educated on the safety of certain things in their environment, right? They're at risk for getting into things like pesticides, herbicides, right? Environmental health risks. We talked about this. Where do you live? What's your dietary history? What's your housing like? If it's older housing, are you exposed to lead-based paint? Are you exposed to pesticides? How's your drinking water? What's your air quality? Those are all the things we have to assess. Occupational and environmental health are pretty similar. That's why I'm kind of talking about them both together. Here's why children are more sensitive to environmental issues. More sensitive at risk for childhood cancers based on exposures, pesticides, herbicides, underdeveloped liver. Their immune systems are not well developed. Kids just breathe faster, they consume more food. Okay, talked about food poisoning or food issues. Salmonella, E. coli from food that is not prepared, cooked. Okay. Okay, let's jump into learning real quick. I've already talked about a lot of this. Patient education is one of our most important roles. Why do we educate? Lots of reasons. Promote health, prevent illness and injury, maybe improve health behaviors, which would be secondary, right? First two are primary: promote health, prevent injury, improve healthy behaviors. Let's say we've screened them and they are at risk for something: hypertension, obesity, substance abuse, suicide. Okay, how do we help them improve those healthy behaviors? We also enable patients and families to care for themselves at home. That's tertiary, right? We know that education empowers. We know that nurses should be educating in every role. We know that literacy is an issue. We know that cultural barriers may be an issue. We know that language barriers may be an issue. We talked about, are they ready to learn? Are they motivated? How do their culture and values and beliefs impact how we teach? Okay, what if they have expectations and experiences that differ from what we need to teach? How do we adjust that? Right? That's why we have to talk to them up front. How do you feel about it? What are your expectations that you get out of this teaching? We talked about a common barriers, lack of self-confidence. And of course, we always want to be supportive and praise and encourage. Okay. Couple different ways we learn, all of us. Some of us are visual learners. Some of us are auditory learners. We like to either see it or hear it. Some of us like to be hands-on with kinesthetic learning. There's 3 domains of learning that we all possess. Okay, and usually one is dominant. Okay, we either learn, and everybody possesses these. So we possess a cognitive domain to learn. Okay, that is your cognitive, affective, and psychomotor. Okay, cognitive is the thinking part of learning, right? You hear the information, you read the information, you understand it, you memorize it, and then you use that information to make decisions or solve problems. And you think through it. Affective is the feeling part. Okay. What are your attitudes? What are your beliefs? What are your values about the subject you're trying to teach? What's your client's attitudes about it? If they don't agree with what you're trying to teach, they may be less likely to learn. Think about it. Have you ever been to an in-service that's a mandatory in-service that you're just not into, but you have to go? Do you really listen to the updates, or is it more, do you have more of the attitude, no, I just got to go to this every year? Boring, I've been through it, but did you really hear the updates? I don't know. But affective, it's your attitudes toward, think of your client, their attitude towards what you're teaching. Let's say they've had diabetes forever and they're sick of learning new ways to test their blood sugar and trying out a new glucometer. Right? They may be a bit saturated on continuing to learn about new ways to do diabetes. Why can't I just do it the old way? Those are attitudes. Then psychomotor is the hands-on. I'm a psychomotor learner. I like to try, I need to have everything. I need to be practicing it. And I did a lot of psychomotor teaching to my students, teaching them how to give their own EpiPens, teaching them how to use their inhalers, teaching them how to check their blood sugars, how to give themselves an insulin injection, how to give themselves a pump dose. Okay, so you have to be cognizant of what the groups that you're teaching. Okay, you may have, let's just say you're teaching a patient to go home, and they want their family involved. Between the client and the family, and whoever's involved in the teaching, some may be cognitive learners and receive it differently than the affective learners in that group, and some may just show me how to do it. Does that make sense? So you need to know your audience, right? Is anybody visually impaired? Is anybody hearing impaired? Does anybody have any motor issues? Does anybody have any comprehension issues, reading issues, language issues? There's a lot. There's a lot to think about. How do we reinforce health education? Right? We always want to make it a partnership. We're always going to be collaborating the patient, the family, and other staff that may be involved. What if they're going home and they need equipment? Like I said, PT, OT, respiratory therapy, they need oxygen at home. Everybody needs to coordinate the discharge planning. Okay, and reinforcing the health education. Plan needs to be agreed upon by everybody. Does anybody have a knowledge deficit that we need to assess? Okay. And we talked about discharge planning. Okay, this is interesting. Learning has not occurred until the behavior is changed. Okay, we know that behavior changes are hard. Our human nature is that we always take the path of least resistance, right? Does anybody work with anybody that whenever you try to implement something new, a new way to do something, or a new material, new piece of equipment, does anybody work with somebody who says, oh, it's just easier to do it, it's just easier to do it the other way? We've been doing this like this for 30 years. It's fine. Anybody work with people like that? Change is hard. Change is hard. Okay. Okay. Questions. We covered a lot. Do you have a better understanding of environmental health and occupational health? And obviously teaching, we're going to be teaching our whole careers. And you get better. You get better with time. You understand barriers. You see them playing out in real time. Right? But our flexibility to adjust to meet clients' needs. I mean, when I was in school nursing, I could be starting out a day at a preschool teaching kids about hand washing, finishing out the day at the high school talking about suicide prevention. You're gonna, depending on which groups you're working with, you adjust on the fly, right? You got to know your audience. What are potential learners' expectations? Okay. And that's with patients, that's with their families, knowing their cultural beliefs. It's a lot to it. But it's an ever-changing, you learn as you go. Right? I mean, just in this class, think of all the different learners I have. And when I meet with students all the time, I can tell their learning styles. Everybody's very different. So my goal is to try and reach everybody in a way that everybody's learning, even though everybody's coming into this class with maybe a different learning domain. So, all right. Anybody have any questions? We are going to break out into 3 groups. So somebody in your group needs to pull up the case study that I sent you in the week 6 announcement. It's at the bottom. There's 3 questions. It's a health education case study. It's really good. And I'll send you, when I send you the class recording later on today, I'll send you the version of the case study that has the answers and the rationales, which we're going to go through. So room 1, answer question 1, room 2, answer question 2, and room 3, answer question 3. We're just going to be in the breakout room for 5 minutes, 6 minutes maybe. Then we're going to come back and then we're going to answer each question. Okay? I like this case study. I think you'll like it. Okay, you're all going into your breakout rooms. I'll see you in about 5 minutes. Sarah, do you want to get into, oh, there you go. Elise, I'll respond to your email after class.
Okay.
I just haven't had a second
Oh,
today.
no, you're cool.
Okay. Do you guys have enough time to answer your question? Trying to be mindful of the time. Did you like that case study? Did it reinforce what we've been talking about?
Yeah, it was pretty neat.
Yeah, yeah. I'm going to share my screen and we're going to answer these questions. I'm trying to be mindful of the time here. Okay, I'm going to send you this instructor version, which has the answers and the rationale, and use this to prepare for your exam as well. Okay, room 1, did you guys come up with answer C?
Yes.
Yes, we did.
Yeah. So one of the core public health principles is asking learners that are participating to identify what their needs are. Right? How do we know what we have to teach them if we don't know what their needs are? Doing an assessment of the needs. Right? Because then we can target our education on what the learning needs are. Right? Room 2, did you come up with answer C?
Yes.
We did.
Yeah. All right. So you're doing an instruction program for a bunch of second graders, right? Related to exercise and fitness. What's an objective? This is a good rationale. Let's read through this. All right. The correct answer obviously is within 2 weeks, we want to see the child demonstrate at least 2 exercises they've learned, right? This is a good rationale about education. Objectives are specific short-term criteria that are met as steps toward achieving a long-term goal. So you have a long-term goal, and then you have objectives to get to that goal, right? So within 2 weeks, each child will demonstrate 2 exercises, right? Their intended outcomes. What is the expected change in behavior, right? And then I always love room 3. Hopefully you got to the answer A.
Yes.
Yes.
Yeah, we did.
Okay, this addresses, and we didn't talk much about this, educator-related barriers. Okay, we're not perfect as educators, whether it's me as an instructor, whether it's you as a teacher, whether it's you as a school nurse teaching kids. Okay, this is an example of an educator-related barrier. Okay, so we have the teacher who's educating children about health promotion activities. He's obese and he's taking frequent smoke breaks. Okay, this is an educator-related barrier. This is a total lack of credibility, right? So this rationale addresses educator-related barriers. So lack of credibility in this case with respect to a certain topic is a common educator-related barrier. The nurse can increase confidence by carefully preparing for the talks so that the information that you're teaching, you understand and can articulate it, right? We never want to apologize for lack of expertise, right? We want to convey a self-confident attitude, right? This is my professional background. This is my personal experience. I am qualified. I'm credible to talk about this, right? But as we have learner-related barriers, we also have educator-related barriers. Okay? So I'll send you that document when I send you the recording. Does anybody have any questions on what we covered today? Occupational and environmental health is really important to the community nurse role because where are we practicing? Out in the community. The community means workplaces, right? The community means environmental issues, environmental risks. You're the community nurse. You have to be doing an environmental risk assessment of your community. What are the anticipated problems? Same with doing home health visits. When you do a home health visit, you're also doing an environmental assessment in the home, right? Let's say they're elderly and they're at risk for fall. You're looking at if they have rugs all over the place, they're going to slip and fall. Is there furniture all over the place? Does the refrigerator work? Right? What environmental risks are in the community, in the individual's home, in the recreation center, in the workplace? So lots to think about. Okay. All right. I'm being mindful of time. It is 5:30. I'm going to be doing my review in 30 minutes. So I need to get ready for that. I hope everybody has a really good weekend. And oh, here's the other thing. If, as you're preparing for the exam to take a week from today, you have questions about certain concepts so you're not quite sure of, please email me next week at any point, set up a time to Zoom and we can talk about whatever you're struggling with. Okay? Okay, well, that is it for class. Good to see everybody.
Bye-bye.
Bye.